Recognize the gentleman from Ohio, Mr. Latta, 3 minutes for an opening statement.
Well, thank you, Chairman, and thank you very much for holding today's markup on these three important pieces of legislation, especially H.R. 1919, the Safeguarding America's Pharmaceuticals Act of 2013. This legislation is the culmination of many years of hard work by legislators and stakeholders, and I'm honored to have introduced this legislation along with Congressman Matheson. Securing our nation's pharmaceutical supply chain is an extremely important issue, and I'm pleased that the committee has made the issue a top priority of this Congress. The pharmaceutical supply chain touches every part of the healthcare system, and it is imperative that we get the structure and segments of it connected in a safe, secure, and effective manner that provides the best protection for patients. H.R. 1919 will make improvements to the current supply chain while providing a clear path for industry stakeholders toward enhanced supply chain protections. Pharmaceutical distribution occurs nationwide, and it is estimated that within the United States there are more than 4 billion prescriptions filled each year. By replacing the current patchwork of multiple state laws with a uniform national standard, we improve safety and eliminate duplicative regulations and create certainty for all members of the pharmaceutical supply chain. When an individual takes a prescribed medication, they should have full confidence that the medication is as prescribed and will not impose harm. It is of utmost importance that we implement common sense solutions to safeguard our distribution supply chain against counterfeit and stolen drugs, as well as improve security and integrity throughout the supply chain. This legislation is an important step toward to ensure greater patient safety for all Americans. To protect patient safety, this bill would replace multiple state laws and create a uniform national standard for securing the pharmaceutical distribution supply chain, therefore preventing, again, duplicative state and federal requirements. It would increase the security of the supply chain by establishing tracing requirements for manufacturers, wholesale distributors, pharmacies, and repackagers based on changes in ownership. The bill also establishes a collaborative, transparent process between the FDA and stakeholders to study ways to even further secure the pharmaceutical supply chain. Finally, the bill puts in place a requirement for the FDA to issue proposed regulations on unit-level traceability. The timeline put forth in this bill for all steps is reasonable and will allow enough time for stakeholders to comply with the new national standards and ensure that through feedback from these same stakeholders that Phase 2 is done efficiently and correctly. There has been much work done on this issue over many years, and I'm appreciative of all the input that I've received on this bill from stakeholders and interested parties. I want to specifically thank the Health Subcommittee staff, my staff, and other House staff for all their hard work on this legislation. I look forward to continuing to work with Chairman Upton, Subcommittee Chairman Pitts, to move this legislation to the House floor, and I urge full support of H.R. 1919. Thank you, Mr. Chairman. I yield back.
Chair, thanks, gentlemen. Now I recognize the gentlelady from the Virgin Islands, Dr. Christensen, for 3 minutes for an opening statement.